yes, the prevalence of mild cognitive impairment is much higher than most people think. And due to the divergent screening tools people used, it'll be, let's say, 10 to 1/4 of persons at the age of beyond 60. But it's also, like many other things, a clear development over time, meaning that if you go to persons above the age of 80, it'll be at least 1 in 2. The problem, I think, why we underestimate and underdiagnose MCI so much is that when we speak about cognition, people mainly think on memory loss. And the specificity of MCI is that it's not just cognition per se, but there are also other signs of it, which are changes in the mood, apathy, depression, irritability, things many people think may come with age in a way a little bit normally, that the personality traits a person has get more, I would say, pronounced. And that's, I think it's why we underestimate MCI so much, which is really sad, that because if we can interfere with cognitive decline in people getting older, it would be mainly be at that stage of MCI. I think it's a chance that our brain is so, I would say, multifaceted, meaning that if we speak about, as I said before, cognition, we mainly think about memory, but it's much more, as you say. And this brings it also to the risk factors. So it's a syndrome, like many other syndromes we have in older adults, like the fall syndrome, like, for example, inappetence, going to nutrition, like other parts, and including cognition. So having said so, there are genetic factors. You know, we have looked at ApoE4, especially with regard to Alzheimer's disease. There are a form of behavioral things. There are the education. There's the social part. There are risk factors which come quite normally with diseases. Older people have blood pressure, diabetes, high blood lipids, for example. And then I think very importantly, it's also behavior changes, which is smoking is for sure a risk factor. Alcohol, we are not so sure, but surely if you drink too much, it's maybe a problem. It may be probably protective if you have only a small amount of alcohol drinking, but then it comes to nutrition. And nutrition, which is more the Mediterranean type, is for sure a protective factor, as it is physical activity. So low physical activity and unhealthy diet are certainly risk factors for cognitive declines. Mild cognitive impairment can be diagnosed in different ways, going from a very advanced psychometric testing in special clinics like memory clinic. They may be biomarkers, let's say in the cerebrovascular fluid, but I think the main issue is with MCI, it has to be diagnosed in an easy way and with screening tools. And there are quite a broad spectrum of screening tools. I would probably say there are 2 frequent ones used, especially in the outpatient setting, and it's clearly an issue that MCI should be diagnosed in the outpatient setting by general practitioners. Screening older person for functionality, like gait speed, looking for nutrition, like with the MNA, and now looking for cognition with another test. And the most used one is the MMSE, the mini mental status testing. The problem there is it takes about 10 minutes, which is it's a long time for an outpatient setting. And with regard to the sensitivity to diagnose MCI, not dementia, but MCI as a very early form from cognitive decline, it's not very sensitive. So many people use the 6-CIT test. It's a test developed mainly in the UK and used there. It's a 6-item test. You have the references in your talk, and it takes you only about 2 minutes, and then can be delegated to non-medical doctors. Mild cognitive impairment is underdiagnosed. I already said a little bit to it before, is that I think the awareness that aging, that there is a normal aging process, but that we really have to capture when symptoms develop which go beyond a normal aging process. So changes in mood, in psychological behavior, as well as amount of forgetfulness may easily and early go beyond what is normal aging. And because we are not such aware of those things, we don't screen for it. So it is neglect to really look and screen all the person for different domains, functionality, nutrition, cognition in an outpatient setting is one of the major problems when dealing with older adults. We measure every time we see a patient blood pressure, for example, but we forget that there are also many other domains we should look at. And this is really sad because the functionality part is for many older adults the most important part when we ask them what you expect from the health system. To stay independent within the family, it's a major issue. And here I would say, please also screen for cognitive decline, even at very early stages.